that there are many factors that can influence the blood sugar level itself. One of them is the level of insulin that our body has. Number two, the insulin resistance, that how well insulin acts in our body. And these things are compounded by multiple factors like our diet, how healthy or unhealthy it is, like our exercise habit, like our body weight, and other associated things like stress, like other associated conditions like infection and all. So there are many factors which actually influence the blood sugar level in a patient with diabetes.
So as we all know, we talk a lot about diabetes these days because we know the number is increasing day by day. And India is a second capital of the world for the number of people living with diabetes. So we know diabetes can cause a lot of complications. The big vessel complication, that is the first one will be the cardiac issue, then the stroke issues with the brain, and then the peripheral arterial disease with the lower limb. So among the cardiac issues, what all things can happen or what are the problems? Yes, we always know about heart attack and diabetes and the combination. So diabetes increases the risk for the cardiac issue, especially the coronary artery issue or the heart attack, which the common men talk about. The risk, it increases the risk by 2 to 3 times compared to people who are not having diabetes. So another important entity which our public are not much aware about is the heart failure. Diabetic cardiomyopathy, or wherein the heart pumping of the heart is coming down, and that can result in various symptoms. The body getting swollen up. Then there can be difficulty in breathing while walking or even talking and all, depending on the various degrees. So heart failure is also another major complication that can happen with diabetes. And there are now many drugs which are helpful in preventing the cardiac failure in people with diabetes, anti-diabetic drugs. And apart from that, another complication with the heart that can happen is arrhythmia, wherein the rhythm of heart, yes, we know how the heart beats, the love dub. So that sound that we all know about it. But there can be arrhythmia. That means the rhythm can go off beat. So that is also more common in people with diabetes or the arrhythmias.
Diabetes also affects the kidneys, and the kidneys the affection is usually occurring at the level of the small capillaries. These are the very small, tiny blood vessels which are supplying blood to the kidney, in addition to various other problems also. So once these small capillaries are affected, the filtration function of the kidney, the other hormonal functions of the kidney are affected in diabetes. The sugar, what we say the glucose levels, is the right terminology to be used. It affects these small capillaries and it creates a difficulty in the filtration function, creates an increase in other excess hormones are generated, and this causes an effect on blood pressure. This causes an effect on reduced absorption of fluid, which can cause increase in swelling of the body and can also affect other organ systems in the body. So that's why we always say controlling the blood sugar levels, controlling the blood pressure levels are very important in maintaining the kidney function. And we many times get asked whether the diabetes medicines damage the kidney, which is not the case. Many of our medicines in fact protect the kidneys. So that is a common misconception that is seen, that diabetic medications affecting the kidney, but that is the other way around.
In our country, a lot of women do the household chores themselves. Maybe that is changing with the evolving society, but still there are a lot of women who do their household chores. But again, it depends upon the amount of calories that they are burning. So it is basically a difference between the calorie intake and the calorie output. So if the amount of calories that they are consuming is more than the amount of calories that they utilize while performing these chores, then they will continue to gain weight. So that is a common problem that we face in our practice. The patients say that they are working all day long at home, which is true. There is nothing, it's not wrong. They do work all day long. But there has to be a moderate intensity exercise. So moderate intensity exercise means when your heart rate reaches about 50% of your maximal heart rate. So the maximum heart rate of an individual can be achieved by subtracting the patient's age from 220. So for a 40-year-old, the 50% of maximal heart rate would be around 90 beats per minute. And so if the patient is having a heart rate between 90 to 126 when they are performing the household chores, it would be a moderate intensity exercise, and it has to be continuous for about 30 to 45 minutes. even with that much level of exercise, the patient would not be burning more than 100 to 150 kilocalories at a stretch, which would be equivalent to maybe 1 or 2 chapatis. So that's the problem. So high intensity exercise is required, and at the same time there has to be a significant amount of caloric restriction. Exercising alone is not going to help with weight loss, because as I said, the amount of calorie utilization that happens with routine activity, which is what household chores are, you will not be able to lose weight with that much activity. Even patients who say that they walk daily for 30 minutes are not able to lose weight because the pace is not brisk enough. With 30 minutes of slow walking, you would not even burn 100 calories. So that's the problem. So how the intensity of the household chores, the duration of the household chore, how much the patient's heart rate is rising, how much they have restricted their calorie intake, all of these would come into the picture when we are looking at weight loss and blood glucose management.
Actually, the reactions from the patient side can be variable. They can have a range of emotional reactions.
Okay.
So that depends on several factors, including their personality, their level of understanding of the disease, diabetes, and their general health. So some of the common reactions include they can actually react like with shock and disbelief. So they can actually deny the diagnosis of diabetes itself. So they can actually react with diabetes, and they may even seek second opinion over the diagnosis of diabetes.
Okay.
So some may actually approach with fear and anxiety. What does this mean for my life? So they might be knowing regarding the long-term complications of diabetes. So I have seen such reactions also, and I've seen denial reactions also. So people might be saying that they don't have diabetes, so it was just a mistake to have the diagnosis of diabetes. And some are actually denying the diagnosis of diabetes with anger and frustration, and they might think that why me? Why I am chosen for the disease? So some people might be actually they may be having guilt and self-blame because of their habits they develop this thing. So they can have excess stress also. So some may actually at least I know that what is going on. Some may accept it with relief, so they will go with the treatment.
Yes, so fasting in India is very much personal. It's very much emotional as well. May it be any religion which we follow. And of late, we have been looking at benefits of fasting in many non-diabetic individuals as well. But for diabetes patients, specifically fasting, there are few beautiful guidelines out there which do recommend a close collaboration with the healthcare provider. Ideally, a person who is willing to fast should come to the healthcare provider a week before the initiation of the fast. One, because there requires to be a detailed evaluation, and there is a stratification of patients into low risk, moderate risk, and high risk of developing complications of diabetes during the fast. If low and moderate risk individuals are there, we do allow them to go for the fast. Of course, with some changes in the medication, we would like to change the medications which has got a lower propensity of hypoglycemia. Of course, we do recommend specific dietary changes when they break their fast, because when a person is fasting for 12 hours, 13 hours, and then they sometimes tend to feast during the break of in the evening. So that in turn causes a increase in the sugars as well. And another important aspect is a self-monitoring of blood glucose. That is, during the fasting phase, we do recommend them to use a glucometer to check their sugars more often, give them particular guidelines when to break a fast, whenever blood sugar is less than 70 or blood sugar is rising above 300, when a person is 300 milligram per deciliter, when a person is having symptoms of hypoglycemia, when a person is having symptoms of hyperglycemia, we do recommend them to break the fast. And the third visit would be recommended post completion of the fasting, when we have to readjust their medications to the original ones, because the person is now going back to his or her routine daily activities.
Has now already become the diabetes capital of the world, right? So you mentioned the number, 77 million people having diagnosed with type 2 diabetes in our country. I would say that there are enough data, enough study to quote that equal number of patients are also having diabetes, but they are still unaware of their diabetes status right now. So that is also one of the irony in our country. So to reduce the burden of people living with type 2 diabetes, if we are talking about, again, we need to understand that the major chunk of type 2 diabetes is coming because of the background epidemic or a pandemic of obesity, the basic weight. So by reducing the sheer percentage of the weight, we can reduce the number of people living with diabetes, we can prevent the development of diabetes, and we can even achieve reversal of diabetes in some of the cases, as you rightly mentioned. So lifestyle modification is becoming the cornerstone of management of pre-diabetes, diabetes and obesity. So what kind of lifestyle changes we can make? So first and foremost comes in this lifestyle modification is the dietary adaptation. So to reduce the caloric amount that we are consuming to match our activity levels, to match our current weight, and to match our glycemic status. So dietary adaptations and to regulate the proper diet that we are going to discuss, that is the first and foremost thing in lifestyle changes. Second is to adhere to a regular physical activity, regular exercise pattern or moderate physical activity to a suggested amount that has been suggested by your healthcare practitioner. Third is the stress reductions. We know there are n number of right from across the ages in our country, across the socio-economic status, and irrespective of the patient's profession or irrespective of the people's profession, the stress levels are affecting each and every individual, and they are day by day increasing, and that is the one of the major reason contributing to not only obesity but also many other complications. So stress reduction is the third most important pillar for lifestyle changes. And lastly, it's a de-addiction. If we are having any of the harmful habits, for example alcohol or smoking, or whichever is the harmful habit which is irrationally affecting our health systems, that's the de-addiction. So these are the four pillars I would suggest as a proper lifestyle change: is the diet, exercise, stress reduction, and de-addiction. So these are from my end. Yeah.
Lifestyle modifications are very effective in prevention of diabetes mellitus. Major studies, just you have asked, like diabetes prevention program across the world, had shown that the combination of weight loss, dietary intervention and physical activity can reduce the development of type 2 diabetes mellitus by approximately 58%. So of course, doing dietary interventions and lifestyle modifications properly, we can prevent development of diabetes mellitus, and there is often a lesser chance of progression from pre-diabetes to diabetes if we follow the dietary modifications and lifestyle changes properly.
Diets based on the calorie counts. So one thing is called as low calorie diet, which is around 1500 kilocalories. Another diet is very low kilocalorie diet, that is around 800 kilocalorie diets. So we recommend the person to lose around 5 to 10% of his body weight, and that is enough to prevent diabetes. So a patient who is obese, say the BMI is in more than 23 as per the Asian cutoffs, we would put the patient on the low kilocalorie diet, that is around 1500 kilocalorie per day. Secondly, the Mediterranean diet is also considered to be very beneficial in preventing lifestyle disorders such as diabetes, hypertension, obesity. So the Mediterranean diet consists of reducing the saturated fats from the diet and focusing more on healthy nuts like ground nuts and almonds and raw food basically. So and olive oil, a lot of replacement of other fats with olive oil. So these kind of diets are very helpful in preventing diabetes. And also if the person is at the risk of hypertension or has hypertension, then DASH diet is recommended for the same. So you can visit your healthcare provider and discuss about all these diets, and they can tailor a specific diet pattern which will suit your body and according to your needs for prevention of diabetes.
Don't lose your confidence, because it's a genetic disease, and first thing is to maintain your confidence in yourself that this combined disease can be managed. Number 2 is seek medical advice, and number 3 is follow the medical advice. These 3 things are the 3 mantras I would say to all patients. So they do require medical help. So it is, though many people brand this as a lifestyle disease, it's really not really a lifestyle disease. majority of the people will get diabetes. So if you look at people over the age of 50, almost 70% have type 2 diabetes. Okay, so that means almost majority of them are getting, and that's genetic. It's a genetic condition. It comes in South Asians like us actually. We can't change the environment fast enough so that all 70% can be prevented just through lifestyle modification. So it does require medical help, and the patient need to do that actually. Follow the medical advice.
My first mantra would be to take ownership of your health and your disease. You cannot delegate somebody to do that for you. So take ownership of your condition, and you should do it as per yourself. Then second, as we are talking about diet and exercise and obesity, we should understand that small steps make a big difference. So if you have not started, start today. Do the advices that we have follow the advices in terms of diet and exercise, and small steps would lead a big way in terms of making you successful in controlling your obesity and diabetes. And thirdly, and most importantly, as I agree with Dr. Anantharaman, that follow your doctor's advice or your healthcare provider's advice. All these advices in the media and the social media, it's not for all. So your doctor is the best person to advise regarding your medical condition, your medication, the kind of diet and exercise that you follow. So that would be my 3 mantras.
Don't try anything over enthusiastically which is non-sustainable, which you cannot sustain, because diabetes, you have to fight with the disease throughout your life once you are a diabetic, and it is not a T20, it is a test match. So you need to be sustained and you need to be sincere in your efforts. That's number one. Again, what my co-panelists have said, please follow the medical advice, because each and every patient of diabetes is different as far as their disease morphology is concerned, as well as their socio-cultural background is concerned. So only your physician will have the overview of the whole thing. So please follow him or her. And number third is, yes, you need to prevent diabetes also. So inculcate healthy lifestyle in your family, because once you are the leader of the family, you have to, and you are diabetic, you need to understand there are every chances that your children might also get diabetic, and maybe at a lower age than you are. So what we need to do is we need to have healthy lifestyles at home, because although it is a genetic disease, but it works on the 2-hit hypothesis. There are environmental triggers. So if you can do away with those environmental triggers early on in a children's life, we can prevent diabetes and perhaps the diabetic epidemic, which is there in the Southeast Asian population.